Assalamu alaikum. Welcome to Dr.Razziq Pharmacist Gateway channel. Welcome Pharmacist community. How are you? Hope are you doing very well and serving humanity. Thank you for joining us. Today we are going to share the one of the important topic with and discuss one of the important topic with you, which is the pharmacist gateway to UK, United Kingdom. What is OSPAP? What kind of document needed, and how you can reach United Kingdom and registered as a pharmacist and work there as a full registered pharmacist, earn more than anywhere in the world. So thank you for joining us. We move on to our topic of today, which is pharmacist gateway to abroad, United Kingdom, UK, which is one of the series we are discussing different countries of the world where pharmacists can work. So today we are going to talk about the United Kingdom. So we start journey to UK as a pharmacist registration. So I hope you already subscribed to Dr. Razziq Pharmacist Gateway channel. If you have didn't subscribe it yet, do it now. So we move on to topic and we will discuss about all the parameters about it. First of all, overview. The slides contain brief instruction and guideline and how can aspire and settle in UK, United Kingdom and registered pharmacists from Pakistan or from anywhere from the world. So here in this topic, we will discuss what are we will discuss the topics and what are the contents of these topic will be. So we will discuss about OSPAP, what is GPSC, assessment exam, registered pharmacist, scope and recommended books regarding to OSPAP UK. So steps for UK registration. First of all, step one, an overseas pharmacist assessment program OSPAP will be done by you on reaching UK. This is mandatory. Without that, you cannot work in UK as a full registered pharmacist. Step 2 will be 52 weeks of pre-registration training approved by the GPSC. GPSC is the government official body of Great Britain. Step 3 will be the registration assessment examination. And step 4 will be the registration as registered pharmacist. So there will be 4 steps when you will reach UK. But mind it, before going to there and documentation process, you will also need a language course mandatory for UK, which is IELTS and PTE. These all required a strict band of which we'll discuss later in this video, and we will tell you what band they required. But in documentation process, you will also need language test. So after reaching UK, you will adopting 4 steps. Step 1, step 2, step 3, and step 4. You can see here these 4 steps are mandatory. Even without first step, you can move to another step. So what is OSPAP? Overseas Pharmacist Assessment Program is OSPAP. OSPAP is 1 year postgraduate diploma course designed to ensure those who have qualified overseas receive the appropriate education and training to prepare for the UK practice and entry to pre-registration training. Entry to these courses needs English language proficiency of IELTS testing of level 7 in each category at a single test. You can also choose Master of Pharmacy degree M.Pharm from any university aggregated from GPSC instead of OSPAP. So, it is your choice. You can do OSPAP or you can do Master of Pharmacy degree M.Pharm from any university. You, if you complete OSPAP course successfully, this will demonstrate that you have the UK M.Pharm graduate criteria, but it will not give you a M.Pharm Master of Pharmacy degree qualification. So all point has been clear here. What is OSPAP? What are needs? Apart for applying for ability to complete an overseas pharmacist assessment program OSPAP form, they will ask you to choose the university where you would like to complete your OSPAP. A list of universities that offer OSPAP courses is given below. Kingston University, University of Brighton, University of Sunderland, Aston University, Birmingham, University of Hertfordshire. The OSPAP course structure and content include structured academic assessment of your qualification, attending specific modules, completing assessments. So these five universities in of UK are offering OSPAP in their universities. So you can select any of them, one of any of them. Pre-registration training placement. Under the supervision of tutor, trainees spend at least 2 weeks in GPSC approved training site, developing their practice to meet range of performance standards. These progress is guided by and verified by their tutor using progress reviews. Both UK qualified M.Pharm and OSPAP students must successfully complete a pre-registration training placement to be eligible to sit in a registration assessment and meet the criteria of registration. The placement for training is paid position and usually full time. So they have also uh, told us pre-registration training placement and what are the criteria and what is the benefit of it is paid or unpaid. They have told us. The registration assessment exam. There are two registration assessments per year in June and September. The registration assessment consists of two question papers. Candidate must pass both papers at one attempt but can have up to 3 attempts to pass registration assessment. The assessment is carried out simultaneously in location across Great Britain. The two examination papers, an open book and closed book paper, are based on practice-based situation and are designed to test the thinking and knowledge which lies behind any action. The fourth step will be the registration of a registered pharmacist. Once you have successfully completed an OSPAP course, 52 weeks of pre-registration training, and the registration assessment, you are now eligible to apply to register as a pharmacist. You will need to apply through the GPSC online system. You must apply to be registered within the 4 year of date you have started your OSPAP course. So here is clearly mentioned that if you have completed your OSPAP, you have 4 years to start your job in UK, Great Britain. Pharmacist scope in UK. Intention intern pharmacist. Working days Monday to Friday. Salary ranges is 10 to 15 pounds per hour. Registration as regular. 58 weeks you can do at job as a intern pharmacist. Internship for registration as a pharmacist followed by GPHEC exam. Regular pharmacist. Community pharmacist salary is about 25 to 30 pounds per hour. Clinical pharmacist salary 35 to 40 pound per hour. Independent prescriber GP practice optional 1 year course. Industrial pharmacist QA QC production and RD. So we have also told you the pharmacist scope in UK as well as intern pharmacist, regular pharmacist, community pharmacist, clinical pharmacist, independent prescriber, and industrial pharmacist also. So Applying for eligibility to complete an OSPAP course. Initial verification process. When seeking to enroll in a OSPAP course, the first step is to have qualification and experience verified to determine eligibility. This is done through the applying for eligibility to complete an OSPAP form. This form contains number one will be application form and fee. Requirement completion of eligibility form and necessary for the assessment of your credentials. Fees, there is a processing fee of £687 associated with this application, which must be paid to proceed with the evaluation. OSPAP eligibility result. Upon assessment, if your qualification and experience align with the OSPAP eligibility criteria, you will be permitted to apply for OSPAP course. Course commencement. Commencement. Timeline, you must start the course within 2 academic years from the eligibility decision date. University selection. Indicate your preferred university for the undertaking for undertake for OSPAP course aligning with your career goals. Non-eligibility. If you deem not eligible pursuing a recognized qualification like an M.Pharm is necessary for practicing as a pharmacist and grade return. So here they have told everything clearly, what is the application form, what is the requirement, what is his fee, which is a £687 with application, and about OSPAP eligibility evaluation. You are successful, you will have 2 years of applying and selection of university. Next will be, we are discussing about qualification of GPSC registration. Candidate aiming for registration with the general pharmaceutical course GPSC demonstrate their English proficiency through one of the following English language courses. Number one is evidence type 1A standardized English language test, which is first is its academic version. Requirement a recent pass with an overall score of at least 7 and no less than 7 in reading, writing, listening, and speaking in one sitting. So they have clearly mentioned if you do IELTS academic version, you need 7 band in each module. If you do OET pharmacy, requirement a recent pass with a score of at least B in each of 4 areas: reading, writing, listening, and speaking in one sitting. Number two, evidence type 2, pharmacy qualification in English. Taught and examined a mainly English speaking country. Eligibility, a recent pharmacy qualification that was taught and examined in English obtained from a country where English is the main language of the communication, excluding the UK. Evidence type 3, professional practice in English. Recent practice as a pharmacy professional. Experience requirement at least 2 years of recent practice as a pharmacy professional in primarily English speaking countries. So, for this area, criteria is so clear that if you do, you have English language test, you will do IELTS and OET with the respective score bands. If you have English uh, qualification in your subject, you have taught it in English, you can do exclude or exempt your English language test. And other is also professional practice in English. If you are practicing in one of the English speaking country, then you can can be exempted your English language test. Generate UK pharmacy registration. Step 1, pre-registration application process for training placement. Pre-registration training is a crucial 24 to 52-week period under supervision of tutor at a GPSC approved site aimed at meeting specific performance standards. Training structure. Duration is 52 weeks, typically full time with part time options upon approval. Responsibility trainees secure their placement and notify the GPSC of their arrangements. Securing placement. National recruitment schemes. Health education in England and NHS education for Scotland run schemes to help secure placement with application through the Oriel portal. Application process. For detailed application information, refer to the Oriel website resource bank. Next is registration assessment. The registration assessment evaluates trainee ability to apply knowledge and make professional judgment and pharmacy practice. Frequency conducted twice a year, June and September. Format is 2 question papers, both of which must be passed in a single attempt with up to 3 attempts allowed. Eligibility training completion. Eligibility depends on the completion of specific amount of training detailed in the pre-registration manual. Step 3, registration. Achieving registration as a pharmacist in UK is the final step. Following successful completion of OSPAP course, registration training and registration assessment. Registration process. Application through the My GPSC online system within 4 years of your starting the OSPAP course. Final milestone. Registration with the GPSC allows the practice as a pharmacist in UK, marking the culmination of your training efforts. Recommended book will be the recommended book for OSPAP in UK will be Community Pharmacy Symptoms Diagnosis and Treatment by Paul Rutter, MCQs in Pharmacy Practice by Lillian M. Azopardi, further MCQs in Pharmacy Practice by Lillian M. Azopardi. So thank you for joining us and watching this video. I hope you understand the process of pharmacist registration in UK. And I also hope you will like the Dr.Razziq Pharmacist Gateway channel. You will also like this video and you will also share this video to other pharmacist community so that they can get benefit benefit from these job videos and other related pharmacist gateway to other countries and abroad countries and different areas of the world. So thank you very much again. Take care, pharmacy community and medical shops. Fimanillah.